The reason I was put in martial arts at 3 is because I was crazy as shit when I was in pre-K. And the pre-K teacher told my mom, you have two. You have the main pre-K teacher and the aide. And the main pre-K teacher was like, this kid's crazy. You need to put him on ADHD, whatever medicine, blah, blah,
Yeah.
blah. And the aide was just like, he's fine. He's just hype.
Yeah.
Mandala chino. That's what she told my mom.
No.
Yeah.
Is that okay? So that is the actual original story. So you went into Chinese medicine to be able to be there for your younger self, right? In a way, you're there to help those who don't have that.
Yeah, younger and older.
Well, that's true.
I don't discredit los viejos. It's gonna be a controversial topic, but in the West, they want to jump on the surgery a lot. Real quick here. In Western medicine, they would have gone with a syringe and extracted the fluid.
Yeah.
Versus it's gone on its own in 5 hours. It's crazy. You know, so that type of medicine is what I'm trying to kind of push for education in this country. And I've already been offered to speak with Tallahassee.
Mindful Combat. Inspiring people, inspiring you.
You got this! Welcome to Mindful Combat. And we are here. Mindful Combat podcast. Okay. Mindful Combat podcast. Inspiring you, motivating you, and helping you grow. And here we have Dr. Lopez / say it.
Sifu.
Sifu.
Or Shifu for Chinese, but we'll just say Sifu. It's
okay,
easy.
so explain that to me.
Oh, well, Sifu is a term in Chinese culture, very, very old school, where you had like in sensei in Japanese, like, master or teacher for the martial arts.
Yeah.
That's how it is in China.
Okay.
So if you watch a bunch of old school kung fu movies, Shifu, Shifu.
Okay.
Train me.
All right.
Yeah.
So, okay. What I'm interested in is the integration or the blend of your two sides, right? So you're Dr. Lopez and you're...
Are you calling me
Sifu.
bipolar?
No!
Multiple personality disorder?
No! I mean, we all have different sides to ourselves.
Yeah.
Right?
Yeah, you have your good side and your bad side.
No! Oh my goodness. Oh my god. You made me think about Maleficent.
Oh.
She has both sides. But no, we are complex creatures.
We are.
Right? And
Very.
so you have these two sides of your career.
Yeah.
Because they're both your career.
Yeah, you can call them two sides or I call them the same. Just like I use them together in the sense where, like, let's say, for example, a patient is, I deal a lot with orthopedics and traumatology. So you come to me as a patient and you have an injury or ACL and meniscus, right? Or rotator cuff. Well, I got to treat you, right? So I treat you Chinese medicine, treat that joint to get stronger as well. So I got to take you downstairs and train you,
So you use a gym for recovery?
Yes, for rehab, recovery, and training. So, I mean, a lot of the time, sometimes I'll even do Tai Chi and Qigong with them for like movements. So I integrate them so they sound separate, but they're the same.
Okay, so explain to me exactly what you do.
I sleep. I
Other
eat,
than sleep.
and I poop. What do I do? So first off, I have the 305 Ninja Academy. That's how it started. And then I transitioned into the Chinese medicine.
Okay.
So now it's both. So I have the clinic upstairs, as you see, and then I have the gym downstairs. I hope they can hear me.
I hope you can, because you're speaking real loud. I hope.
Can you hear me?
Oh my goodness.
So, yeah, I just hope they can. Let me just point it towards my mouth. The two integrated in about 2023 is when I really started to integrate them when I was done with school and I was taking my board exams. I really just kind of like started to bring them together and make sure that the people who I bring in are being helped in ways that I wasn't able to be helped when I was an athlete professionally. Yes, I was a professional athlete, before you ask.
What happened that you were not able to be helped?
Well,
I mean, if it's okay. You
absolutely, that's fine. So it's going to be a controversial topic, but in the West, they want to jump on the surgery a lot. Real quick here. Yes, we have physical therapists where they can do treat, in that sense to strengthen, but there's a huge gap in between. And that gap is treating soft tissue injuries and fractures and bruising, just bruises. What do you do when you go to hospital, you have a bruise? Oh, too bad, wait for it to go away. You know what I
Yeah.
mean? Like, no. So in Chinese medicine, that huge gap is full. Treating, as a matter of fact, last night I actually had a problem right before Christmas. Right? Hadn't slept and I was working really hard before we went on vacation, and my knee got swollen up,
Yeah.
and that I had surgery on that knee. Long story. That's my athletic.
Yes. That's the story that you were telling
Yeah, yeah, yeah.
before.
There's a lot of
We'll go back to it.
cool, and it got swollen, so I was kind of limited when I was snowboarding because I didn't take all my medicine with me. And yesterday I was treating one of my patients, and I was like, I'm just gonna make my medicine. So I went downstairs. I have all my medicine, all my herbs, and all my stuff there. I powderized them, and then I went and I cooked them into like a balm,
Uh-huh.
and I put it on
Uh-huh.
at, I'd say, 1 p.m. At 5, wasn't noticing it. At 5, I noticed I'm walking normal.
Oh wow.
So
Okay.
at around 8:30 p.m., I take the bandage off, and all the swelling was gone. And this is not the first time, but it's the first time I physically experienced it on myself. Because when you see these things on your patients, it's like, oh yeah, duh, it works. But like when you do it on yourself, it's very different. So yeah, the swelling was gone. I was walking normal. I was like, damn, I should have done this like 2 weeks ago, but didn't have
You
it
have
with me.
enjoyed the skiing.
Yeah, it would have been. I would have probably pushed myself too hard snowboarding anyway, so it
Okay,
was
that's
probably
true.
better not to. But yeah, the instability is still there, so I need to condition the joint, like we were talking about earlier. But the inflammation, the synovial fluid inflammation, which in Western medicine they would have gone with a syringe and extracted the fluid,
Yeah.
versus it's gone on its own in 5 hours. It's crazy, So that type of medicine is what I'm trying to kind of push
Okay.
for education in this country. And I've already been offered to speak with Tallahassee, with for the Board of Medicine of Acupuncture and Chinese Medicine. So it's a big thing because as a martial artist yourself, combat, uh, this is where it came from. It came from martial arts, Chinese martial arts, and Japanese, and all these martial arts. They needed medicine because like people were getting banged up,
Yes.
you know,
Like my toe right now.
like your toe.
It's been messed up for
Right.
since
So
October.
like for example, the medicine I can make for your toe make it better. So things like that. A toe or like a bruise from getting hit a lot, or
Yeah.
a fracture, or,
Yeah.
you know, so yeah, I think it's very important. Medicine.
All right. So
Gross.
let's go back to the story if you still are willing to tell it. I don't know if
Absolutely.
you-
Absolutely. I'm not sidetracking. It's just there's like a lot. So
Yeah.
I was a elite gymnast, right, for USA, and I wasn't on the USA team, unfortunately, but I guess I kind of was because I competed as a US for US, I
Okay.
guess. So as like you get to a level in gymnastics where you're an elite, right, and then you just go and you can compete internationally, and then you're technically USA, but you're not Team USA,
Yeah.
right? So you're competing against like Venezuela and Russia and whatever,
Mhm.
right? Okay. To be Team USA is a different thing.
Okay.
So credit to all my Team USA people. I love you. And the people who are competing now, which were little jits when I was competing.
Yeah.
So I was, competing, and I was trying to get on Team USA for Worlds, and I blew my knee out. So I wasn't at practice. I wasn't doing anything cool. It was comendo mierda. All right. All right.
Okay.
So translation, I was eating crap. All right. Warming up for like a parkour competition.
Okay.
And I was so exhausted again. I'm saying this on purpose. I'm
uh-huh.
saying this on purpose.
Yes.
I was so exhausted and, I guess malnourished at the time, that my knee, it just went. My ACL just went, along with medial meniscus and stuff. So I had surgery. Again, the only avenue. Versus, I know there's some physicians out there that go with therapy first.
Mhm.
But if you're going to be a very active and like world-class athlete,
Yeah.
you need to get that repaired, right?
Yeah.
Because if not, your knee's gonna be like,
Yeah.
So
You
yeah, I
needed
had
to work fast.
yeah. So I had the surgery, recovered quickly, and then came back to it. That's that story, but that story has a lot of sides to it, like you said,
Mm-hmm.
because you have the understanding of why it happened.
Yeah.
That's why I kept saying I was tired
Exhausting,
and
yeah.
overtrained, right? And then you have the malnourished side. Does that mean I wasn't eating? No. That means that you have to understand nutrition, how the body absorbs nutrients, and how stress and things can affect that. And then the injury, and then how to treat the injury. So it's like a multifaceted thing.
Yeah.
And understanding that was time and this medicine. It was like this medicine changes people's lives drastically when you understand it correctly. So that's how I want to help people. I want to help the athletes that I didn't have that. Let me say that better. I want to help the athletes that don't have that now that I know how to help you, you know?
Yeah.
So like your toe.
Yeah.
You know, when I help your toe get better.
So you didn't have somebody there to help you,
I
and
didn't
so you
know
want
this
to be that
existed.
person.
I
Yeah.
didn't know this existed.
Yeah.
And I, in my heart, I knew. I was like, there has to be it. I know there has to be it. So I used meditation and qigong, which is
Yeah.
what I knew at the time, and I healed really fast. But it's not the same if you have qigong and this medicine. You heal faster, you
Yeah.
know. And sometimes, not all the time, you won't even need the surgery.
Yeah.
You know what I mean? There are definitely many times where you will. Not discrediting that, but I'm just saying it's not always. You know.
Mhm.
So yeah.
Yeah. I mean, you just reminded me. I have 5 herniated discs in my lower
I have a
back.
lot of patience with vertebral. Yeah.
And I know because you've helped me like stretch my back because I do
I
gymnastics.
told her she
obviously.
knew me. She's lying to you.
But I went to the neurosurgeon, and they
Yes.
said that before the surgery I should go to a chiropractor. I ended up not doing any of that,
Quack, quack.
and I started running.
Uh-huh.
I started at that point. I wasn't doing karate. I was doing it was this thing called what was it called?
Typo. No, I'm just kidding.
It's Les Mills, and they have like all kinds of exercise,
Okay.
and they had
Kickboxing or whatever.
combat training. It was combat training. I just thought, oh my goodness, that's why the name. So, and I started doing yoga.
Oh, okay.
And I used to fall, and I literally was the kind of person like, I fall and I can't get up.
Uh-huh. You need a
And-
life alert.
Life alert. And I did those 3 things, and then I've never fallen again.
Yeah, the yoga would help you a lot
Mhm.
with your,
Yeah,
like you'll see in Pilates.
yeah, and the
That's what helped
karate.
you, yeah.
I mean, then I started
Martial
doing
arts.
karate.
Oh,
And,
yeah.
yeah,
Yeah, building that base, you know,
Mhm.
horse stance, you know, and all that stuff.
yeah,
A lot
yeah,
of people don't understand the magic in a true horse stance.
yeah.
It
Because you
builds
do karate as well.
I didn't do karate. Karate is Japanese. I started with taekwondo,
Okay.
which is Korean, and then I went into the Chinese martial arts realm, which is
Okay.
a lot. So you have the Shaolin, you know, animal styles. You have the long fists. You have Wing Chun. You have the southern styles. You have the northern styles. You have the soft and the hard styles.
Yes.
It's a lot. It's a huge world.
So you went into Chinese medicine to be able to be there for your younger self, right? In a way, you're
Yeah,
there to
I
help
guess.
those who don't have that.
Yeah, younger and older.
Well, that's true.
I don't discredit los viejos. Okay, los viejos need me too, which
That's
I
true,
treat
that's
a
true.
lot of viejitos.
Yeah.
You know,
Okay.
because you know they have a lot of degenerative
Yeah.
per se degenerative joint diseases,
Yeah.
which that's what they call here. You're getting old, man. You need some lubrication in your joints, so you
Yeah.
gotta get those joints. You know, and I want to bring this up because this is something important. I feel that is one of the reasons why I opened adult classes at the 305 Ninja.
Okay.
Is that a lot of us when we hit 20, boom,
Uh,
oh, I'm old.
a long time ago.
Listen,
Okay.
listen.
Sorry.
We're both in the same. We kind of like say, "Oh, that's it, can't do anything anymore." And it's like, dude, come on, you're super young. So a lot of people like blame things on being old. Oh,
Mhm.
this hurts because I'm old. Like I have young people with these pains and injuries, so it's not because you're old.
Mhm.
You're not stretching. You're not conditioning your joints. Some of us
Yeah.
have more mileage than others in that sense, but you still got to take care of yourself. So you still can heal and you can still get back into it because I had people in their 70s doing Ninja Warrior. 70s.
That's
competing.
amazing.
So like, come on, dude.
Yeah.
What's your excuse? So you got to put the time into your body because you have to be mindful,
Yes.
right? of your body and mindful of your motion of what you do. So I think that's important.
Absolutely.
Look, I'm being serious. Isn't that cool?
That's weird. I was kidding. I was kidding.
She knows. She's gonna tell me later. You're so weird. You were serious.
I'm kidding. No. Well, and I'm also curious. So I know why you got into Chinese medicine now. What got you into gymnastics?
Well, actually, what started everything was martial arts.
Okay.
I've been doing martial arts since I was 3. Yeah.
Okay.
So what brought me into gymnastics was that I had done martial arts for a long time. And I was like, I've always wanted to do gymnastics. So I begged my mom for years and years and years, and she finally put me in gymnastics. And I went into artistic gymnastics. What's artistic gymnastics? A lot of people don't understand that there's different sects of gymnastics, right? You have artistic, you have trampoline and tumbling. So trampoline and tumbling, which is another one, which is an Olympic sport as well. You have acro, which is like the one that you see people like, they flip each other and they catch each other. It's really, really cool. Check it out. And then you have like they call it like adult gymnastics. If you're older, you can compete in it. Really cool. All right. So I started with artistic gymnastics, which is what you see: the bars, the beam, the vault, floor for women, and then rings, P-bars, high bar, all that stuff. Pommel horse for men, right? And then I came back to gymnastics when I was 19. And I did trampoline and tumbling. So I was a tumbler.
Okay.
And my coach, Coach Jordan, was an Olympic trampolinist, which I miss him very much. And that's how I became an elite. It's long story short. So that's what brought me into gymnastics.
Okay.
So going back to when I was a kid, I did gymnastics. And that was, I guess my coach liked me so much. Whether I was good or bad, whatever. I guess I was pretty decent. He wanted me on team, and he was like nagging my mom. I trained with the team, but my mom didn't want me to compete, which brings me to why I came back when I was older.
Okay.
I competed when I was older and then went pro, which was cool.
So your mom kind of took you out from competing?
She didn't let it happen.
Okay.
That happened. She said it would take away from school.
Okay.
That would have helped me because I have so much energy when I was a kid, you know?
Yeah.
So like you for sure.
Yeah. We talked about.
Yeah, for sure. So that would have helped. But it's okay, you know, life does its thing. So I love my mom and I love my parents, you know.
Yeah.
I just came back to when I was older. So where were we?
Well, the importance.
I haven't had enough oatmeal.
I want to go back to something very important, right?
Yeah.
You talked about the gymnastics would have helped because you had a lot of energy.
Yeah, same with the
right?
martial arts. Like
Yeah.
I competed only twice, right? I went to a very popular Taekwondo school here back in the day. It was called Choi's Taekwondo. Grandmaster Byung-ho Choi, God rest his soul, he's passed away. He was like my grandfather, man, to a lot of us in Miami. If you trained with him, he was like the man down here. Pioneered it and grew a lot of really amazing athletes. And lost my train of thought again.
It's okay. You got emotional because of your.
No, I just haven't eaten enough oatmeal. I need to eat
Get
more.
some oatmeal. Get some.
Every single time I'm about to eat, I have
friends.
you ask me a question.
Go eat.
So,
That's fine.
Yeah, that wasn't a very, very powerful time in my life because he was a very big role model for me and a lot of people in Miami.
So, while you're chewing your food, the importance of, for me, from everything that you said, and I want to go back to the fact that, again, gymnastics, and I know you just said that it would have helped with kind of focusing. For me, right? One thing that I always tell my clients, for example, and I'm going to be COVID. In COVID, I was
The Great Plague of 2020.
Well, for me, it changed my life because I was stuck in my office for 8 hours seeing clients, sitting down, and you know, I'm highly hyperactive, and so I was exercising. I was exercising for like 3 hours in the morning to be able to work for that long. And so you're absolutely right. A lot of the times we think, no, this is going to take away from school, but for somebody who is
Very
hyperactive,
mentally stimulated a lot. Yeah.
Exactly. It is important.
Yes. Yeah. Very. The martial arts aspect. When I was, actually, it's funny how you say this. The reason I was put in martial arts at 3 is because I was crazy as shit when I was in pre-K. And the pre-K teacher told my mom, We had two. We had the main pre-K teacher and the aide. And the main pre-K teacher was like, "This kid's crazy. You need to put him on ADHD, whatever medicine, blah blah
Yeah.
blah." And the aide was just like, "He's fine. He's just hyper.
Yeah.
Mandalo al chino." That's what she told my mom.
No.
Yeah,
Is that okay? So that is the actual original story.
that's the origin story.
Yes.
My origin story
Yes.
from pre-K. Yeah. So
Okay.
so the origin story was I was fucking hyper. Okay, and I was so fucking hyper that so my mom put me in Taekwondo with Grandmaster Choi, and then that changed everything because all that energy was sharpened. My coach in gymnastics, he used to say, "You have all this power, all this energy, and it's like a big light, and you have to raise your focus it into a laser."
Yeah.
So I guess that was my first focus in that sense when I was a kid. So put me in martial arts, you could clearly tell who I was. I have those home videos. You see that one, he looked like Taz from Toon.
Tasmanian?
Yeah, it was
yeah.
just spinning area. I like to spin and kick and spin and kick. And so
Yeah.
someone kicked me so hard from spinning that I never did it again.
Oh.
No, it was fine because that's how you learn. So I was like, oh shit, maybe I shouldn't spin so much because I can't see what I'm doing. You know?
Yes.
So that's like, you know, you learn in life.
So she never put you on medication.
No, didn't need it.
Yes,
Yeah.
absolutely. So
Yeah.
that is another point. And I mean, I know we've talked a lot about medication. We've talked
yeah.
a lot about, but the importance of you're talking about somebody who's completely wild, right? Whose parent chose to do that. I was completely wild too. I was put in piano and guitar and tennis and karate.
That,
I had to do a lot.
I haven't even dived into my professional career in music. I also did. Yeah, I was signed to Sony at 17 years old with my
What?
band. Yeah, Défoncé.
Oh wow!
Yeah, it was an amazing band. Amazing band. But yeah, I started playing drums when I was 4.
Uh-huh.
Yeah.
So you see the point of when we're able to do that, when we're able to channel that big light, that ray, and then focus it
Yeah.
and have people that can mentor us to do that when you're born with so much,
Yeah.
right? You don't need the medication, right? You may not need the medication. I tell my parents, I mean, when I think about medication in children, I think about drug addicts.
Yeah, I see it more as a suppression.
Well, it does.
Of course.
And when you work with somebody who's
Neurokinetic,
done
of course.
Yeah.
Yeah.
When you work with somebody who's been doing drugs, for example, since the age of 13, and I see them at the age of 50, I
Oh.
know that I'm working with a 13-year-old brain. Because there's
That's
so
a
many
really good way of saying that.
Yeah.
Yeah.
And because the brain hasn't had the ability to develop.
Yeah,
it
never
was
developed after
stunted.
that.
And so that's why we have to be very careful about why we medicate, right? So I think we just went like so
No, we didn't because there's a realm that here, the realm is wide, so there's lots of points that we can hit.
Yeah.
You know,
Yeah.
This is why I'm gonna do a talk because one area can hit so many points. that
Yeah.
you're not gonna do that in one talk. You know
Yeah,
what
no,
I mean?
of course.
You know?
Yeah,
Yeah.
yeah. So we leave this one for next time,
Exactly.
so we could dive into that.
Exactly.
All right.
Yeah.
So, is there anything?
Next time on Dragon Ball Z. I love that show. It's the best.
Oh, my brothers are big fans. My my middle brother, the middle one has like a whole.
You have
little
brothers?
museum. I have 2 brothers.
No shit.
Actually, I have 4 brothers and a sister.
Oh, really?
Yeah.
No
But
wonder.
that's for another. That's
That
for
is-
another time.
That is for another time.
But if you had.
Shit everywhere,
Chew
bro.
your food. Chew your food.
Mhm.
I feel like I'm here with my children. I'm kidding. So if there's anything that you would like to teach people or teach yourself, if you were to talk to that younger self,
Uh-huh.
right? What would you say?
Honestly,
Yeah.
I wouldn't say anything
Oh, okay.
because it's important that I lived through what I lived through. You know, which is a whole other topic that I feel like people try to skip that,
Yeah.
and I feel it's very important that you teach through that. So if I do go back, I would guide myself no more than what I was guided already. You know what I mean? Because every step I took from when I was a kid to now brought me to who I am now. So I don't want to circumvent any of those lessons, you know?
Yeah.
That's why I say that. Yeah.
Very good.
Yeah, no, because I wouldn't change anything. Because if I did alter that, it would alter who I am now, you know?
Mhm.
So I would, yeah, I would say that.
That's right. I think that's a
You weren't
beautiful.
expecting that, were ya?
I never assume. I'm always curious.
Yeah, yeah, yeah. I think
So
that's an important thing because sometimes you do in retrospect, you know, you think about it, like, oh, I shouldn't have done this, and I shouldn't have done that. But then if you didn't do that, what would be different?
yeah.
You know, I'm a
And are
huge,
you willing to give that up?
yeah, and like, you know, I'm a huge science nerd, you know, Stargate, you know, Star Trek and stuff like that, and time travel, you know, is it a multifaceted, multi-universe thing? Is it linear, whatever, right? So if you change the past, does it change this future? Does it change another possible future? Either way, right? I believe that it's like multi-dimensional in the sense where you could have made a different decision every moment, and that's like a different outcome.
Yeah.
But the outcome I'm in right now, you know, I like where I'm at. I'm at peace with where I'm at. You know, not perfect at all. You know,
Yeah. Nobody
we
is.
all have our things. I'm always working on myself, but I'm happy where I'm at now, and I'm sure in 10 years when you ask me, I'm sure I would have grown more and whatever. But yeah, I'm not gonna go back and change anything, man. Sorry. As much as there's painful parts in your life, you're like, oh, I wish I would have changed this because it's so painful. Those moments are very, very powerful, learning and growing points. You know, so I feel like that's important.
Absolutely.
Yeah, yeah, yeah. I'm sure maybe you feel the same way. Maybe not.
Absolutely. You have to go through a period. But again,
I
this
don't
is
have
for
my
another.
period.
This is for
Don't have
another.
that.
Oh my goodness.
No.
A period of, if you've had a hard life, you have to go through a period of grieving to get to that point.
Yeah, absolutely.
I don't think everybody has gone through that. I have gone through a lot of it myself, so I am at that point where I'm pretty happy. I don't know, the word serene comes to mind when it comes to my life, even though there's fluctuations to it.
Yeah, I
because
didn't
we're
want to use the
human.
word content either because content usually comes with the connotation where you're just like, oh,
Settle.
yeah, I'm settled. No,
Yeah.
I'm not settled. It's more like, I guess, at peace. I
Yeah,
guess, yeah, we're
yeah,
saying it the same. Yeah.
So we're gonna leave it here.
Okay.
I have to say something because we didn't continue about the medication. I just want to say that
Oh yeah.
if
Let's talk about
anybody who's medicated their children, again,
We have time.
everybody's trying the
Okay.
best that they can, right? With the information that we're given,
I was
just like
about to say that.
just like your surgery in your knee.
Yeah, yeah, yeah.
So I
know.
just want to say
We're
that.
not trying to like bash anyone.
No, that's very.
I
important.
am. No, I'm just
No,
kidding.
he's not.
But-
How dare you?
But like what we're saying is that like everyone tries to do the best with what they've got
Yeah.
at the moment in
Yeah,
time. So
absolutely.
yeah. But in listening to people who have experience and maybe doing research and maybe trying another way, you learn another way. You know what I mean? So that's what we're trying to say.
That's it.
Right?
That's it. Yeah.
Yeah.
And
Guys, please remember that we are not your psychiatrist and we don't know your specific case. Your child may have hallucinations, may be putting themselves or others at risk, and this may be a very different case than the one we are talking about. So always ask your trusted doctor and psychiatrist. Thank you for listening. Continue to enjoy.
sure, where can they find you? What are you offering? What are you up to right now before we end?
What am I offering? I kind of said a lot of what I was
I know,
offering, right?
that's
So we're obviously located in Miami, Florida, in Doral. I own the 305 Ninja Academy and the 305 AcuMed, which is my clinic. Technically, 305 AcuMed and Ortho Sport is the name of the company.
Very
Okay?
good. Very good.
And yeah, so we have that here. We offer, like I said, you know, treatments for all orthopedic and trauma injuries, also general medicine. I treat even every disease that you can think
PG.
of. No, yeah, it was definitely PG.
Not you.
Yeah, but you know, obviously, PG-13 would be like, sexual issues, like hormonal stuff
Yeah.
like that.
Yeah,
I can
yeah.
treat. We've been talking about working together because she can work the psychoactive area, and then
Yeah.
I can work more like the body.
Mhm.
So that's what I mean. But I can treat anything. And at the 305, we teach ninja warrior. We coach gymnastics, martial arts, aerials, which is like circus and stuff like that, parkour.
Yeah.
Weird people.
And they can find you at Instagram.
305 Ninja Academy or 305 AcuMed.
There you go. You got this.
You got this.
Bye.
Bye.